Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with the Montgomery County Medical Society? Find out right now. My guest this evening is Dr. Carolyn O'Connor, President of the Montgomery County Medical Society. Carolyn, welcome to Housecall.
Well, thank you for having me, Dave.
My pleasure. So briefly, tell our viewers about your professional background.
Well, let me start at the beginning. I'm from this area. I'm actually a proud graduate of the Montgomery County Public Schools. I graduated from Walter Johnson High School. For college, I went out west because I had family connections there, so I attended UCLA. Mm-hmm. I ended up going there for undergraduate school, medical school, and my family medicine residency. Mm-hmm. But after residency, I turned around and headed back home to this area, and I've been here ever since.
Very nice. And tell us about your private practice.
So I'm in practice in Rockville, Maryland. I've been practicing in the area for 32 years, and it's been my privilege to work in this area for so many years.
And how did you end up becoming president of our medical society?
Well, you know, I had joined the medical society not immediately out of residency, but probably 15 years ago, and I recognized the value of the society to our physicians and our patients, and I recognize the value of organized medicine as a voice for physicians. So as I expressed my interest, I was invited to be on the board and then eventually invited to join the leadership ladder, and this year I'm president.
Congratulations.
Thank you.
How big is the medical society at this point?
The medical society is about 1,600 physicians who live and work in Montgomery County.
Very nice. So compare and contrast then for our viewers the Montgomery County Medical Society with the Maryland State Medical Society, also known as MedChi.
Correct. Montgomery County Medical Society, or MCMS, is a component of the MedChi, Maryland State Medical Society. The State Medical Society, there are a number of components of the large counties and Baltimore City, and then there are some of the smaller counties are small components, and anyway, together we're a voice of organized medicine in Maryland.
What do you view as the president of the Medical Society as some of the key healthcare issues in Montgomery County in particular, and of course statewide? Well,
I think there aren't going to be any surprises when I tell you that the things that we worry about are access to care and insurance and regulations. I think from a public health standpoint, we worry about the opioid crisis, and also the issue with public health as far as obesity epidemic, people not exercising, smoking, stress. I think all of these things play a big role in and affect our citizens.
So it sounds like the Medical Society's mission is not just to represent physicians in the county, but the community at large.
Absolutely, that's right. I think our mission is to support physicians and their practices and also the public health. And that's near and dear to our hearts, and I think that we keep that mission in focus as we communicate around the state and with our state legislators and other regulators.
So in terms of communication, does the Medical Society and/or the State Medical Society actually have a lobbying presence in Annapolis?
Yes, we do. We have an arm that keeps an eye on legislation that can affect medical practice. Every year, the state legislature, which meets from January to April, looks at hundreds of bills that affect medical practice and also the public health. And so we have a team that keeps an eye on that. We also have twice a year a governing body of House of Delegates that convenes for the State Medical Society for MedChi to evaluate what matters are of importance to us, both locally and nationally, to bring to our state legislators, and we also bring ideas and concerns to the national level through the AMA.
Very nice. Now, besides lobbying in Annapolis on behalf of physicians and by extension our patients, do you have any interface directly with the community, whether it's public health fairs or dealing with the Montgomery County government, anything like that?
Well, we do. To answer the question, I hope correctly, we have, for example, our Montgomery County Public Health Officer is on the board of the Medical Society. So in that way, we interface with the public health service that's going on through the Department of Health in the county. We also, there's a Montgomery County not Board of Health, but Commission on Health, and we have a representative that sits on that body as well.
So it's reciprocity. That's
yes, and that way we have two-way communication with our local county officials as well as the times we spend going up to Annapolis.
Now, you mentioned in your opening remarks a variety of important healthcare issues, and let's circle back and touch upon those. You mentioned, for example, access to health. Montgomery County is one of the wealthiest counties in the country. Are you implying that access to healthcare is an issue in our county?
Yes, I think it is. There are still, despite our wealth and affluence, there are uninsured and underinsured. And furthermore, there are folks who can't find participating physicians in their networks of their insurance. So I think that there are many issues in that regard, and I hope that the legislators and physicians and patients and citizens are able to work on some of these problems together, because everyone, I believe that health care is a right, and everyone should have access to good quality care.
The Trump White House and the Republican leadership in the Congress has done everything they can to get rid of the Affordable Care Act, so-called Obamacare. What are your thoughts as the president of society of the threats with the Affordable Care Act?
Well, my own personal opinion is that I think the Affordable Care Act is a wonderful thing, and I think that those that would attack it have other motives behind rather than having their focus on what's best for our citizens. Because once again, as I say, my opinion is that health care is a right and everyone should have access to it. I think in Maryland, the legislature and the governor have stepped up to the plate and helped support the Affordable Care Act in Maryland and the health care exchanges, health insurance exchanges, excuse me, and I really think that Maryland is a national leader in this way. It doesn't mean there aren't obstacles and challenges ahead, but I think our hearts are in the right place.
I certainly agree. To amplify, though, the question about President Trump and the Republican congressional leadership, if they have their way, they are encouraging people to enroll on these stripped-down health plans. What do you think will happen to the healthcare exchanges you referred to in terms of costs for patients that try to enroll?
Well, I do think that this is the problem. If you offer cheaper plans, people will inevitably flock to them because costs are so high. But what they don't realize is that their benefits will come back to bite them. There may not be coverage for maternity care or cancer care, or there may be lifetime limits. The Affordable Care Act set many guidelines on what services had to be covered. Yes, those are expensive, but those are needed, and those are when your family or yourself experience that crisis or that important thing, such as obstetrical care, to find out that you're not covered. it's being penny wise and pound foolish.
To amplify on that, if somebody is young and healthy and they, purely for cost reasons, enroll in one of these stripped down plans that usually has at most 1 year duration, what happens to them if during that 1 year they suddenly develop a chronic condition like diabetes and then it's time for renewal? They now have a pre-existing condition.
That's exactly right, Dave. This is exactly one of the benefits of the Affordable Care Act, was the fact that people could not be denied for pre-existing conditions. And the thing about healthcare is that everyone is going to need it sometime. And if you are, we all end up paying for everything. Mm-hmm. I mean, if someone is uninsured and they go to the hospital and are unable to pay, those costs are passed along to others. Furthermore, people who are underinsured will tend to delay care or avoid preventive services because it's expensive, and therefore will end up sicker and in the emergency room, where the cost of care is much higher, and an ounce of prevention would have saved a pound of cure. Absolutely.
Let's go on to discuss the opioid crisis. How bad is it in Montgomery County and statewide?
Well, statewide, Maryland is not immune. It's not, all the states are affected. I think certain counties in Maryland are more heavily affected. Fortunately, the data doesn't show that Montgomery County is the worst, and I don't have at my fingertips all of the data to share, but that doesn't mean we're not affected. And I have personally had patients who have lost children, had deaths in their family from opioids. So my heart breaks and it terrifies me.
Absolutely. Now, we have a minute left before the break. Tell our viewers, what is the action plan for both the Medical Society and the State Medical Society dealing with the opioid crisis? What are they actually doing?
Well, a number of things have been done. We offer a lot of education to physicians. We supported, MedChi supported legislation in the last session of the legislature that was to support preventive services and also treatment services. That is really what's needed. We also have, our physicians have to follow the law and query a database to see whether people are obtaining controlled substances from pharmacies, so that we will know not to be victims of people who might be looking for medications for the wrong purposes.
Very good. We're going to pause briefly for a public service announcement. More with our guest, Dr. Carolyn O'Connor, President of the Montgomery County Medical Society. We'll be right back.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
We're back. My guest this evening is Dr. Carolyn O'Connor, President of the Montgomery County Medical Society. Carolyn, when we paused for the break, we were discussing different societal health issues here in Montgomery County and statewide in Maryland. What do you hope will be some of your achievements as president of the society?
Well, the first thing that I've thought about as I took the reins this year, the first thought I had was this organization has been around for 115 years. And when you take the helm of such an organization, the important thing is to kind of keep steering the ship. And sometimes you find stormy seas. So I hope that that the organization will pass through the year safely, and that I'll hand it off to the next leader in good shape. And I hope to build membership and bring other physicians in the county to recognize how important their voice needs to be joined to the rest of ours as in organized medicine. I think sometimes we get distracted into our own little silos, and we don't realize how connected we are, and that your frustration may be my frustration. Sure. So I want to bring that message to our other, to physicians throughout the county.
What can physicians do in Montgomery County besides caring for their patients at a grassroots level to help with the countywide issues you've described?
Well, again, I think the first thing is to join the medical society, where your voice can be heard and you can mingle with your colleagues to learn what common frustrations we have, and to bring that to the legislature and other regulators, because medical practice is not easy. And when I think the losers in the equation can be the patients. If physicians retire early out of frustration or burnout, you know, that replacing a physician costs many $1,000s, and that's one more chink in the problem of access to care.
Sure. What can patients do if they're concerned about some of the societal issues we've discussed this evening, such as access to care, opioid crisis, or other health issues?
I think that getting in contact with their legislators, you know, the biggest impact we can all make is by voting, and that is first and foremost. And I cannot emphasize enough, and obviously not everyone's going to agree with me and vote the way that I vote, but everyone must vote. And the other thing is to, you know, your local legislators want to hear from you, and I think personal experiences ring very loudly in their ears. So if someone has been denied care or had some outrage from their insurance company or what have you, I think the legislators need to hear that on the most local level. And I think physicians also need to communicate that, get to know the legislators, and we all citizens need to get to know ask questions, what policies do they have, and get to know get behind, donate time, donate money to legislators whose attitudes and views accord with your own.
You mentioned a few moments ago doctors retiring, and you also used the phrase burnout. Explain to our viewers what exactly is this phenomenon.
Burnout is not unique to medical practice or physicians. It could occur in any occupation or perhaps any situation. It's a sense of emotional exhaustion, depersonalization, and you don't bring your A game, and you start to see everyone as just maybe not the enemy, but the problem. And our patients are not the problem. Our patients are our purpose. And you know, on a good day, when you can take a breath and you realize what an honor and privilege it is to serve patients. And my work as a family physician is incredibly gratifying. I have patients I've been seeing for 30 years. I see families. I've had families of 3 and even 4 generations that I've taken care of. Seen people who I met as children who are now parents themselves. So those kinds of interactions and relationships are just amazing, and it's been an incredible privilege and gift to my life. But you know, if doctors retire early, the patients are going to lose that chance to continue that relationship with their physician.
Now, certainly I, as a practicing gastroenterologist, have seen a tremendous amount of technology embraced by my practice. What do you see in terms of technology advances for private practice in general here in Montgomery County?
Well, I think the main thing is the electronic medical record, which we've been wrestling with for the last 10 to plus years. And I think that has been perhaps beneficial in some ways and also a problem. You know, unfortunately, the computer, I think many people have said physicians have become very high-paid, you know, data entry clerks. And we end up having our face in the screen instead of looking at our patients. And occasionally I try to remember to apologize and look up from time to time and say, you know, that I haven't forgotten that you're here. And I think that fortunately for me, I think I do have some long-term relationships. And so I think my patients are somewhat forgiving. I hope they are. And I hope they accept my apology. But you know, I think it's debatable how much benefit. I think it helps regulators and insurance companies track data for quality measures, and quality is important. However, I think what's lost is the human touch.
Yeah, I agree. In my case, what I did to try and maintain that eye-to-eye contact is I wear a headset, and I have a voice recognition program, and I simply dictate my note as I'm speaking with the patient.
And I think that is probably good, and also they're actually hearing what's going into the record. And that I think that we are not done with this. I think that at the moment the electronic record is a problem, a hindrance, and a huge time waster. And I think that in the future, people smarter than me and younger and more tech savvy will realize a vision of making this less of an obstacle and more of a help, but we're not there yet. Now, I feel like I'm a pretty fast typist, so therefore I'm typing as I'm going, but that means that my head is down a lot.
Yeah, of course. As you well know, one of the real problems with electronic medical records, countywide, statewide, nationally, is that it's a big Tower of Babel. We have dozens of different electronic medical records out there, and most of them cannot communicate with each other. Is anything being done at a county or state level to try and get better communication between different electronic medical records?
Yes, a lot is being done. We have a program here in Maryland or locally or in the area called CRISP, which is the Chesapeake Regional Information something.
Right.
But it's called CRISP, and this organization has connections to all the hospitals in Maryland and to medical practices that are signed up for it. And there is access to, for example, in my practice, we are able to query the database to learn what patients have been to the emergency room lately. I'm not going to be able to say everything that it's capable of doing at this time, but it certainly does make the dream, and some of this is realized even now, of say being able to see what lab tests or radiology reports, and I think in the future they'll actually be able to, you'll be able to look at the images, for example, electronically through CRISP. CRISP is also helps us with a database for finding out whether, what I alluded to earlier in fighting the opioid epidemic, a database for seeing what controlled substances have been prescribed to our patients and by whom.
So in other words, if a patient is a drug abuser and you're going to multiple doctors for the same prescription, you'll be able to track this.
That's correct, and I think that that is an excellent tool. Now, unfortunately, you know, the opioid crisis, while it may have been started and fueled by medical prescriptions, unfortunately, there's the illegal drugs of heroin and fentanyl that are many times people started with a leftover prescription for a narcotic in the family medicine cabinet, and when those ran out, they went elsewhere. And those things, especially fentanyl, have skyrocketed the death rate from opioids. Physicians definitely have a role to play and have to bear a lot of responsibility, but unfortunately the problem has really spiraled out of control.
Has the medical society, or for that matter the state medical society, taken a position on medical marijuana?
I do not know everyone's opinion on that or what our policy is. I have my personal opinion, which is that I think that before we go prescribing something as medicine, it needs a lot more research. We try to practice in 2018 evidence-based medicine, and the fact is that marijuana is being proposed to be used for this, that, and the kitchen sink, and I think that without data, that is all just hearsay and anecdote, and I think that people deserve better.
Yeah, I certainly agree. Now, as you well know, one of the big trends locally and statewide and nationally is a change in the medical marketplace. Many doctors are simply frustrated with traditional private practice and seeking employment, for example, being hospital employed. Still other doctors are banding together to form what we call mega groups. What is your sense of the pluses and minuses of all these trends?
Well, you know, I think that it's somewhat of a shame, but, you know, things evolve and we're not practicing as we did 50 years ago or 200 years ago. And so it's neither good nor bad, it just is. But, you know, I think that the fact is that with the demands of technology and supporting these expensive information technology systems and following numerous regulations and tracking data, inevitably a small practice has difficulty keeping up with that. And so some of my primary care colleagues have gone into concierge practice.
Define for our viewers, what is that? That
is a practice in which the patients become members. They pay a fee up front, say a yearly fee, to be a member of that practice. But that fee, and the physician probably limits his practice to, or her practice to, a smaller number of patients. It allows those patients to receive very personalized care, but that cost can be prohibitive even for our affluent Montgomery County citizens. Sure. And therefore, it takes out of the market a lot of primary care physicians who could be serving more patients, thus reducing access to primary care. And, you know, I think we need a better strategy. I think that that can improve physicians who are getting ready to, later in their careers, where they've built up a clientele of loyal patients who have want to stick with that particular doctor and can afford it. I think that helps those patients, but it's a shame because it sort of takes those physicians out of taking insurance. Sure. and being available to a larger pool of patients. Anyway, back to the sort of original question of the cost, and because of the prohibitive costs, we see physicians becoming employed or banding together in ever larger groups, and I think what's lost is the personal touch, the personal relationship. Sure. Even my own practice just 6 weeks ago went from a 5-person practice to join a larger group. Okay, all right. We have 1 minute left. What is the National Capital Physicians Foundation? This is an organization that was founded by the Medical Society 2 years ago. It's a 501c3 charity, so donations are tax deductible, just like to the Red Cross, for example, and it's dedicated to population health, but the first project we've tackled is physician burnout, which you asked me about earlier, and I think that this is so important, as you can tell by the passion in my voice, about access to care and keeping physicians who have experience and a lifetime of training and learning to keep them practicing so that our citizens will have access. Terrific. Dr. O'Connor, if our viewers have any questions about what we've covered tonight, how can they reach you? Well, they can reach me at president@montgomerymedicine.org, and the foundation is dedicated to health.org. Thank you for joining us on Housecall. Thank you. It's my pleasure. My thanks to Dr. Carolyn O'Connor, President of the Montgomery County Medical Society. My thanks to my terrific team here at the studio. And most important, thank you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next topic, it's going to be a fascinating one. My guests will be Dr. Barry Green and Dr. Joseph Green, noted bariatric surgeons, and they'll be discussing a new technology, installing balloons into the stomach to help people lose weight. It's going to be a fascinating show. See you then next time for another edition of Housecall. Good evening.